Okay, here we go. Find my other screen here. Okay, so good afternoon, everyone, and thank you for joining us today for this rules workshop. I'm Amelia Boyd. I'm the program manager for the Medical Commission and the organizer for this webinar. This meeting is being recorded and will be made available sometime next week. Teams webinar is a new platform for us, so I apologize for any technical issues that we may have. The documents which will be discussed here today are available on the rules in progress page of our website, which is wmc.wa.gov. And there will be a call for comments and discussion, so please feel free to speak during that time. And right now I will begin the roll call of panelists and staff. So when I call your name, please introduce yourself. We will start with Christine. Go ahead and introduce yourself.
Hi, I'm Christine Blake. I'm a public member of the commission.
Okay, hold on. And then Dr. Chang.
Hi, excuse me, Poshan Chang. I'm commissioner from Southwest area.
And then Melanie, go ahead.
Hello, my name is Melanie De Leon. I'm the Executive Director for the Medical Commission.
Then Dr. Domino.
Hi, I'm Karen Domino. I'm an anesthesiologist and a member of the commission.
And Dr. Jager. If she's able to unmute herself. Okay, maybe she cannot unmute herself. All right. Fatima, if you and Micah would go ahead and introduce yourselves.
Yeah, sure. I'm Fatima Mirza, the program case manager for the Medical Commission. Good afternoon.
I'm an attendee.
Okay, Micah's.
Micah Matthews, Deputy Executive Director for the Medical Commission.
Thank you. And then Mahi, if you would go ahead.
Good afternoon, everyone. My name is Mahi Zaru. I am the Equity and Social Justice Manager for Washington Medical Commission.
And then Heather Carter, if you would go ahead.
Yeah, this is Heather Carter. I'm an Assistant Attorney General, Legal Advisor to the Commission.
Thank you. And then Dr. Jager, are you able to speak? Okay, well, I've unmuted her, so hopefully she can speak at some point. So Christine, if you'd like to go ahead and get started on the script.
Sure will. Good afternoon. As mentioned, I'm Christine Blake, a public member, and I will be the presiding officer for this rules workshop. Today is Thursday, April 20th, 2023, and it is 1:39 p.m. This meeting is being held via Teams webinar and in person at the Labor and Industries headquarters, located at 7273 Linderson Way Southwest in Tumwater, Washington. The rule being discussed today is regarding the requirements of engrossed substitute Senate Bill ESSB 5229, an act relating to health equity continuing education for healthcare professionals. Ms. Boyd, please give an overview of the rules process and the proposed timeline.
Thank you, Christine. So a rule is a regulation. It's a rule or regulation. It's a written requirement that applies broadly across a group of individuals or entities that enables, guides, or directs them to do something or prohibits them from doing something. And then specifically, a rule establishes or subjects individuals or entities to penalties if it is violated, or is a qualification or requirement that gives a benefit or privilege, or sets qualifications or standards that an individual or entity must meet to get a license or permit, or set standards that must be met before a product or material can be sold. So why are we creating this rule? We are creating this rule to meet the requirements of ESSB 5229, which, as Christine mentioned, is an act relating to health equity continuing education for healthcare professionals. And then this is a quote from the bill itself that says that we have to create rules before January 1st, and that the rules that we adopt must say that health professionals have to complete health equity continuing education training at least every 4 years. And then here's our proposed rule development timeline, which we will talk about again later.
Thank you, Ms. Boyd. Are there any questions regarding the rules process and proposed timeline? Hearing none, the next item on the agenda is to discuss the draft language. Ms. Boyd, please present the draft language.
So the draft language will be very similar between physician assistants and physicians. The only big difference is that we state that it's physician assistant in one and physician in the other. And this is based off of the model rule language that the Department of Health came up with. And so we are just creating language that's based off of what they have already done, which is something that was also required in the bill, with that DOH create model language. And so this is the language we are presenting for adoption.
Is there any discussion of the presented language at this time?
Doesn't look like we have any hands raised.
Okay. So any
Do you want us
questions?
to make a comment or not?
Sure. Yes.
Okay, so, we all have lots of CME requirements. And I must say it does, being in practice a long time, and with all the new opioid requirements as well, it as a physician, I feel a little tired of all the requirements. However, I can tell you, having worked at the University of Washington and having had a lot of CME related to this, to the problems that we see regarding health equity in the past year or two, that type of training is phenomenal, regardless of what population you work with. And it's not just dealing with racial issues. It's dealing with alternative lifestyles. It's dealing with gender bias. And I found it very illuminating to me. I found it some of the most important of my continuing medical education activities. And I think 2 hours is fairly modest. It counts upon what your requirements are. So I'm very much in support of it. I was a little less supportive before I knew what it was, and I'm really happy that I've had that training.
Thank you, Dr. Domino. Are there any additional questions or comments regarding the draft language?
We do have one hand raised.
Okay. Go ahead, please.
Billy, if you'd like to go ahead.
Hi there. Good afternoon. This is Billy Dickinson. I'm the associate policy director with the Medical Association. We sent a letter in expressing our support for the model rules adopted by DOH, and we're really pleased to see those incorporated here. In drafting those rules, the DOH held a number of listening sessions and stakeholder workshops, and the rules really represent collaboration between patient groups, physicians, and other healthcare professionals. We also really appreciate their focus on implicit bias. Our recommendation, as noted in the letter, is that WMC adopt identical rules. So thanks for your time and the opportunity to provide comment.
Thank you. Are there any other questions from the attendees that haven't been answered, Ms. Boyd?
There are no other hands raised.
Okay. Thank you for your participation. Ms. Boyd will now discuss the next steps and provide contact information.
Okay, so the next steps are that we will bring the draft language to the full commission for review and possible approval at their May 26th business meeting. Then we will draft the required documents and send for the Department of Health review by the end of May. And then we hope to have our rules hearing held in August of this year. And at the hearing, there will be another opportunity to comment on the draft language. So if anyone has any comments that they didn't think of today, there will be a 30-day comment period prior to the hearing. So there will be an opportunity, and there will be an opportunity to testify at the hearing itself. So we will put this draft language that if it's approved here today, we will put it out on our website so that people can comment back on it before the May business meeting, and it will also be in our packet for the May business meeting.
Thank you.
And then here's our contact information. And so if you have any questions, you can certainly reach out to me, this medical.rules@doh.wa, or it's supposed to be wmc.wa.gov, sorry. That is my direct email address as well. So.
Thank you. Is there anyone else who wishes to comment at this time? If there's no one else who wishes to speak, then I will close this workshop. Thank you all for your participation.
Thank you, everyone.
Thank you. Take care.
Thank you.